So this is a demonstration for venipuncture and phlebotomy. So this would be when we are drawing blood work from a birthing person, either during our clinic or postpartum, to send to the lab to gain various, get some various information depending on what we're looking for. So today I'm going to use the small lavender tube that we would normally use for a complete blood count, or a CBC. That's a 3 ml lavender. And I'm also going to do a 3.5 ml gold top tube, which we would typically use these together to get a CBC and a ferritin. There's other various things that you can use this gold top tube to draw, but for the demonstration purposes today, I'm just going to say I'm drawing a CBC and a ferritin. So we would want to make sure we have the correct lab requisition, that it's filled out correctly, and that we get all our supplies. So for this demonstration, we're going to need a person. We're going to need a tourniquet. We're going to need our non-sterile gloves, which I'm already wearing. We're going to need some alcohol wipes to clean our site. We're going to need a vacutainer, which in this case we have a vacutainer with a tube attached to it. These come in various ways, with the tube not attached, with a needle and a vacutainer. This is just what we have today, so this is what we're going to use. You can see that it's the appropriate size for an adult, 23 gauge, 3/4 inch. And we have a gauze or a cotton ball to apply to the site once we've completed the venipuncture, and a piece of tape to secure that, as well as our sharps container for disposal. So as always, we're introducing ourselves to our client if they don't already know us. We're asking what the client's name is, what pronouns they use. We're gaining consent for this procedure. So this client has consented to have a CBC and a ferritin drawn today. We'll be washing our hands and putting on our gloves. We're going to position our client's arm in an area where we can see the vein. We're going to use our palpation skills to palpate which vein we would like to draw the blood from. And as you can see, I'm palpating. It looks like this is a nice spot right here. Choosing the biggest, straightest vein in this case will be to your advantage. So we're going to apply our tourniquet onto our client's arm here, so that we can make these lovely pregnant veins a bit more bulgy so we can see exactly where we would like to go. We're going to take our alcohol wipe and clean our site. And let it dry for 30 seconds. And while you're letting it dry, you can get your equipment together. So if we need to attach our needle to our vacutainer, this is the opportunity for you to do that. In this case, we have one that's already attached, so we don't need to attach anything together. It comes all as one piece. See the needle, the sharp here is covered. So we're going to select our vein, anchor our vein, insert the needle at a 30-degree angle with the bevel up, so you can see here that the bevel, that little angled piece at the very end of the needle that makes it sharp, you want that to be up. So our site is prepped and clean, and now we're going to do our blood draw. So we're going to ask our client we should ask them if they're okay sitting down, if they'd like to lay down. Some people have a fear of needles, so it's important to be cognizant of that and be aware. So we're going to insert our needle 30 degrees after we've anchored our vein, which is right here. And I always kind of warn them before I poke them. 1, 2, 3, poke, ouch, ouch. And we're in our vein. Now, we have our vacutainer in our hand, securing the needle with our finger, and we can now draw our blood. So here's our 3 ml lavender tube for CBC. I'm going to draw our blood. There's no blood volume in this person, but we would push it down solidly on the vacutainer, and the vacuum would withdraw the blood through the tube and into our vacutainer tube. Then we draw our gold top tube. Same exact technique, pushing down firmly, the blood coming through. You can fill it 3/4 of the way if possible. Remove it, same thing. And we would want to have our sterile dressing ready. Take off our tourniquet, complete, and cover. Withdraw our needle quickly and gently apply pressure. Now this is a sharp, so it's really important that we dispose of sharps correctly so that nobody gets hurt. Avoiding needle stick injuries. Put our sharp in the sharps container and label our vacutainer tubes with our patient's label. And ensure that they're correctly packaged with a matching requisition for transport to the lab. Now, if this patient is still bleeding, you can apply a little bit of tape to the cotton ball or the gauze, but sometimes they will just hold it on their own and it'll be stopped bleeding within a couple of minutes. Take our gloves off, dispose appropriately, and we are done.